I think in general, times of crises, epidemics, pandemics, and especially the COVID-19 pandemic serve to expose issues that exist on a day-to-day basis, but have just not been sort of out there for everyone to see. And this is no different. We know now that vulnerable communities are affected in a worse way than some other communities. Communities of color are affected more in terms of the death rates. Residents of communal settings, for example, nursing homes, or homes for those who require long-term care, people who are in prisons or in jails, where, by definition, you're a little bit more helpless than if you were in the community. There are communities who are not in the US, but who are very disproportionately affected, such as refugees and asylum seekers across the border and IDPs in other countries. So we know, again, those are communities that to begin with are vulnerable, and they are in forced situations where they have to be in what we call congregate settings. And as we know, one of the best and only protections that we have from the spread of the coronavirus is the ability to distance, to have a physical distance from one another. People in nursing home, people in jails, people in prisons, people in detention centers are not able to exercise that public health measure. They're also not able to exercise the very strict hygiene recommendations that are needed to protect oneself from the spread of the disease, because they don't have access to running water, or they don't have access to soap, or there's not enough of the soap or hand sanitizer as you would need to fully protect yourself, or that you don't have access to protective equipment like masks and gloves. So those are usually situations where people who have less are disproportionately affected. People who live in households where you have a large family or multi-generation families who live together in a small apartment, much harder to exercise these public health measures. People who are essential workers, who work in the service industry or in stores, they are essential workers. They have to go to work. Those are, generally speaking, populations that are more vulnerable. They are usually populations of color. They make less money. They don't have the options that some of us do, and they tend to also be in settings where even if they wanted to practice some of the protective measures, they're unable to. One other issue is we're just beginning to find out about this now, because for the first few weeks and a couple of months of this pandemic, the data that had been collected at the state level or at the city level, and certainly at the federal level, did not look at those criteria, at those demographic variables. So we didn't know. We suspected that some vulnerable communities would be disproportionately affected, but now it's becoming very, very clear that communities of color, communities where there's the poverty rate is higher, communities that live in dense settings, that they are much harder to protect. They are affected, they're infected at higher rates, and they die at much higher rates as well, unfortunately.